To qualify as a medical doctor, you undergo training for a period of 5 to 6 years. Afterwards, you join a 1 or 2 year internship stint. However, there have been queries from the Ministry of Health and the Ministry of Education over the quality of some medical professionals. This, according to the Ministry of Health, explains the idea of subjecting them to a special examination before internship is being suggested. The move has sparked mixed reactions from members of the medical profession. According to the president of Intern Doctors United, Leonard Mutebi, it is improper to subject a trainee doctor to an exam after 5 years of intensive training and research.
Maybe you put like cut-off points and say for private universities, this is the cut-off point for you, for someone to enroll into medicine and surgery, into pharmacy, into nursing. Not you waiting for someone to first complete 5 to 6 years of studying and then you introduce an exam. Someone has already paid for those very many years and now you're introducing another exam. You try to make them fail because their goal, they put a minimum and they say we want 1,500 interns. Once they achieve their goal, the rest are going to fail. That's how they make.
If public universities are saying we are taking people on 3 principal passes, that's where the regulation should start. Why do you allow some people with 1 principal pass to do a medical course? So competence begins at entry and throughout the training.
Mutebi says such a test should be subjected to those who want to join the medical school.
That's why the exam is being done in other countries, not Uganda. So we don't want the government to just be copying and pasting things they have just seen outside there, not knowing what they have gone through to implement such things.
The interns are also concerned by government's failure to enhance their salaries.
Because the presidential directive was very clear. It said an intern should always receive half of the pay of their seniors. And so the intern nurses who are currently receiving 1.5 is not half the amount their seniors is getting. Likewise, the intern pharmacists, if their seniors getting 5 million, is half of that is supposed to be 2.5. Right now they're still receiving the 2 millions.
They propose that only 10% of their dues should be taxed, in line with President Museveni's promise in 2018.
President said it should be half what the senior gets, and it comes to 2.4.
They promised that by the beginning of this financial year, they will rectify that, and we want a commitment on that, because half of that is 2.5. Then the 10% tax that we are asking for, this was a presidential directive also.
Their call for revised salary enhancement comes after Tuesday's statement by the Minister for ICT and National Guidance, Chris Baryomunsi, that government plans to enhance all civil servant salaries in a phased manner.
My appeal to the local government public servants who are threatening to also engage in industrial action is that, like I have said, like the President has been communicating, we have a comprehensive plan to enhance salaries for all public servants, including those in local governments.
Report is compiled by Chris Semakula for CTVPM edition.